Nora, can you hear me?
Yes, now I can.
Okay, great. So this is Claudine. I'm sorry, I must have been on double mute. And I will just go right into this. I was already talking, so I'm glad you said something, Nora. So good afternoon, everyone. This is Claudine Jones-Rafferty, and I want to welcome you all to today's noontime training event. As you're well aware, we were originally scheduled to deliver training on food insecurity for contact tracing staff. However, due to some recent emerging priorities and updates to our quarantine guidance, we are repackaging today's training to prioritize updates and delivery of relevant information for your work. And I am pleased to welcome our center director. This is Nora Yates. She's the director for the Center for Community Health. So Nora.
Great, thank you. Hello everyone. Over 1,000 people are here. It's amazing. 1/5 of our contact tracing workforce. Hi everybody, thank you for signing on. I know there's a lot of folks who weren't able to join, so we are going to post this very quickly, hopefully on CT support. But we wanted to take a few minutes to talk about the updated quarantine guidance. If you're not aware, New York State issued new guidance on December 26th. It was distributed, I think, yesterday, but it was officially dated the 26th, which changed the quarantine period from 14 days to 10 days due to the CDC changing their guidance, which you all were aware of because it caused a lot of confusion with actual contacts. So New York State is making this change. There's tons of steps that need to happen with our contact tracing program to implement this change. So we wanted to have this training just to regroup with all of you on what this means, for new contacts that you're interviewing today for the first time and how to make those changes, for existing contacts that we're doing monitoring calls with, and then we'll have some time for Q&A and hopefully answer some questions. And for those questions we can't answer, know that more guidance and more information is coming. I will kick it over to Brian. Brian Beckinson is with our Bureau of Clinical Disease Control. And if you don't know, he's been with us and focused in the central southern tier region, but is very close to the statewide contact tracing program. So Brian, over to you.
Hi. So a couple of things just to add on to what Nora said, and then I'll pass it on to the folks who are really going to let you know kind of how things are going on. Basically, what's happened is CDC changed their, as I think most of you know, CDC changed their guidelines for leaving quarantine from 14 days to two different options. One was leaving after 10 days, and one was leaving after 7 days with a positive test. For the past several weeks, we've been sort of debating the pros and cons of adopting that for New York State. And on Saturday night, the guidance from us came out, and that basically said that we were going to endorse stopping quarantine after 10 days. We're not going to wind up doing the release from quarantine after 7 days with a positive test, or with a negative test, I'm sorry. So the change for us is that we are going to allow people to leave quarantine after 10 days as long as they've been completely asymptomatic for the duration of their quarantine. So who this impacts so far are the people who are in quarantine as of December 26th and people who are starting quarantine after December 26th. So we have kind of two different groups here that we're talking about. One is the people who are kind of active and open in quarantine, and then the people kind of from here on out who will be being put into quarantine. Like Nora said, there's a lot of things I think that have to get done here from a CommCare perspective, as well as from a kind of an everyday how we work through our day-to-day activities standpoint as well. And we're going to try and make this change on a couple of different fronts. The first front is going to be for new people working forward, basically putting them into a quarantine that's going to be 10 days, and we'll talk about a little bit about that as we move forward. For the people who are already in quarantine, I think we're going to try, and we all should cross our fingers on this, to see if we can do some bulk changes to that so that it can, so that those folks will be kind of shifted to a 10-day quarantine sort of behind the scenes, and everything will sort of get fixed with regards to that. And then the third phase of this will be when we're actually able to make the changes in CommCare. As you might expect, doing something like this involves some programmatic changes, some programming of CommCare to shift some of these. And the timing of the announcement has not kind of coincided real well with Damaji being able to make some of those changes this week. So hopefully we'll be able to get the changes made within CommCare sometime over the next week, maybe two, and then hopefully be able to have everything as smooth as possible going forward. There's a couple of things I want you all to think about and remember as we kind of talk about this sort of before we jump into some of the tech aspects of this. While the quarantine itself is only 10 days, the responsibility of the person who is in quarantine does not end at that 10-day period. The incubation period for COVID-19 is still 14 days. And the reason that CDC made this change, there's probably a couple of different reasons, but one of them is because there's some good kind of compelling evidence that shows that we can get 97% or so of all the COVID cases within 10 days as opposed to 14. And we think it's probably a lot more likely that people will maintain a quarantine if it's 10 days instead of 14. But what we want to do is we still want to make sure that people are checking themselves for symptoms on days 11 to 14. So when you talk to people and talk about this particular quarantine, we want to make sure that you still are going to reinforce with them that they're going to have to check themselves for symptoms even after they're out of quarantine so that they can check from day 11 to 14. They should still be doing the same thing that we ask everybody to do, but we really ask people in quarantine to do, the increased hand hygiene, the increased use of face masks, and so forth. And we still want to be able to let them know that up until day 14, if they have any symptoms that develop, they should self-isolate, contact their local health department, or contact their provider. That's even after they're out of quarantine. It would be on day 10. If anybody had symptoms at all during the course of that first 10 days of quarantine, in theory, they probably should have gone into that PUI bucket. But even if they didn't, you're not eligible at that point to wind up getting out of quarantine at 10 days. You'd still be looking at a quarantine of 14 days. So that's kind of the quick overview of kind of what this change actually is. Again, what we're trying to do is build a little bit of a bridge here until we can get everything kind of up and running within CommCare. And we're going to kind of talk a little bit now about how to build that particular bridge. And I'm going to pass it on to Amy Robbins, who I think you all know from these trainings as well. And Amy can go from here. And like Nora, I'll be around and we can talk about if there's, policy questions or things like that a little bit later on. So Amy, if you are on,
Amy, you might be on mute.
Yep. Hello, everybody. I'm going to, as Brian was saying, I'm just going to run through some things on the CommCare screens. For those of you who are on listen only, this will be recorded so you can see it. I'll also try to walk through the pages. I'm going to use two different examples. One, when you're doing an initial call to a contact, how you can then change that quarantine end date. And a second scenario for when you have a daily monitoring call, when you can then change the end date when you're doing a daily monitoring call, or you're going back into the record after the initial interview is complete to update it. So as Brian mentioned, we can't exactly make the changes right away to make sure that CommCare automatically calculates using the 10-day instead of the 14. So until those changes go into place, we will have to manually change the quarantine end date. So what I have up here is an example from our UAT environment of an individual who needs a call for an initial daily call. So you open up the record, and I'm going to page down a little bit so it might look a little fast on your screen. You have the record open, the case info, the contact info. You're going to go through and do the complete interview, gathering the demographic information, answering the questions that come up, and then you're going to get to the part that talks about the actual quarantine. So you're going to go past symptoms, and it's going to take a little bit to get down. It's near the very end. When it comes to this section, it's called Quarantine Isolation Assessment. And this is where the script reads, since you were in close contact with someone who is positive for COVID-19, it is possible that you are also infected. Since your last contact was on, my example here you can see is 12/28. You'll need to be quarantined until midnight on, and it says 1/11/2021. The system is still using the 14-day calculations. So if you're reading these scripts, you're going to have to either change them in your head to think about the 10 days on the initial interview, or reword it to say 10 days. The next portion of your script that you have, it says it can take 2 to 14 days after contact with someone with COVID-19 to show symptoms. It goes on to say you are required to monitor your symptoms for 14 days since the date of last contact with the positive person. There's still a contact that's still required to monitor for symptoms for 14 days. It's just their quarantine period is ending at 10 days. So they need to monitor those additional 4 days, as you heard Brian mention. As you continue down, you're dealing with the script that talks about the quarantine. You come to another script, which I'll highlight right here, for contacts. It's a similar script for travelers. It says you will need to quarantine for at least 14 days from the date of your last exposure to the person who has COVID. This is actually going to become 10 days. Until we can update it in ComCare, it's just going to be a trigger point in your brain that where you see 14, you would need to change that to 10, except for the self-monitoring for symptoms for 14 days. Also good for people just to self-monitor for symptoms all the time, considering we're in a surge. So those are the main points in the scripting. And as you go through the quarantine period, you're going to have there's a couple other spots in the script that says you must still quarantine for 14 days. And then under the school settings, it says 14 days. So anywhere you see 14 days, you change it to 10 in your brain and say that to the individuals as well. So when you come to the next section, you come to the actual quarantine details. Bulleted out is the quarantine start date, the end date, the notice sent date, and the release notice sent date. This is on the initial interview, so nothing's been sent yet. When it comes to the quarantine start date, that's the date that the last exposure occurred. You have it as 12/28 in this example. And then you have the quarantine end date is now listed as 1/11/2021. That is the 14-day calculation. We need to change that because the quarantine end date is used for the text messaging, the date printed out on some of the quarantine notices, things like that. So when we go in, the next question down is overriding the existing quarantine start date. Don't need to do that. That date is correct. The next question is, do you want to override the existing quarantine end date? This is where for every single quarantine contact that's going to be in quarantine from now going forward, you would need to say, yes, you need to change that quarantine end date. It's going to come up and say, what do you want the new quarantine end date to be? This is where it will be handy for you to have a calendar handy, a way to tell this, because especially right now we are between months. So it's not as easy as, say, if it was like my next example, December 20th, you add 10, that makes it easy. Here you've got one that's December 28th. So you have to look at the days forward and you have to count down what are 10 days from December 28th. And that comes out to be 1/7. So that's something just to think about as you're going forward, if it's easy for you to have a calendar handy or the days to calculate this, because we are between months right now. Then you would come down after doing the new quarantine end date and you would send the welcome email as usual. If that's what your counties do, you'd send the email packet. which is going to have the quarantine order. It's going to verify the email. You would say yes. And now it's going to send out the email packet with the quarantine order. And if the quarantine order for that county specifically states what your quarantine end date is, it is going to come up using this new quarantine end date of 1/7 instead of the calculated date of 1/11. So that's what you would do for an initial interview when you're going through. Now I'm going to go back and I'm going to find one that's going to be an individual who's already had the initial interview, and now you'll be going ahead and doing a follow-up call. So you're going to go into the individual's record. And you have the information on the case info, the contact info, the notes, some scripting, and you're coming up to the daily follow-up monitoring section. You're going to have to go to view, update the rest of the contact information. And then you get to the full interview information if you need to update anything. If you don't click that button, the information should come up below for the quarantine isolation assessment section, and it should be visible even if you don't click that section. So those are two ways you can get to it. And then you have the large quarantine isolation scripting. We already reviewed some of that. And now you come up to the quarantine details. You can see the start date was 12/20. The quarantine end date is listed as 1/3 because it's calculated using the 14 days. So now you want to go in and change this to be consistent with the new guidance for 10 days. You're going to come down to the question, do you want to override the existing quarantine end date? And you're going to click yes. And you're going to change that date to be the 30th. And then, unfortunately, this example I just put in, it typically is going to come up, and I apologize for this, it will say resend, and you would click resend. This example, because it's in UAT, hasn't had the email packet sent yet, but there'll be an option that comes up to say resend. So it's pretty simple. It's the same questions that you would need to do on both. You would need to go in to do override the existing quarantine end date. You enter in the new date that you've calculated for 10 days out, and then you either send the email packet in the quarantine notice or you click the button to resend the quarantine notice. So I can show you really quickly. We have put together some documentation to help with this. It's on the contact tracing, the CT support webpage. If you go to home, you go to quick links. The very first one there is called Overriding Quarantine End Date. This is the quick reference guide to be able to do this quarantine end date. So this is something that you're going to want to have handy because that will help. It's a one-pager, and it's going to show exactly what I just showed here, where you go in to override the existing quarantine end date, yes, and then the quarantine end date you would enter. And then if you have an individual who's already had a quarantine notice sent, it's going to say, give you these options to resend the quarantine notice email with the start and end date above, and you're going to click on that, so it will resend that information and give them a new quarantine notice. So this is all needs to be done until we have the system updated so that we'll automatically calculate it based off of the 10 days instead of the current 14 days. Once you change this existing quarantine end date, whether it's for a new record or for someone who's already been in quarantine and had the initial interview done, that quarantine end date should update the SMS and the text messaging so that their text messaging will then end on day 10. Unfortunately, right now, just so you guys know, the end text message, so the last text message people get on their quarantine end date does say 14 days, and so we're trying to get some of these things fixed as quickly as possible. But just so your awareness that you have it is that quarantine end date for the text message does state you have completed 14 days of quarantine. So there are a few little things that might still happen. Just for your information, that's going to still stay 14 days on the text message until we can get that changed. Brian, I'll turn it back over to you for questions.
Sure thing. I am trying to plow through some of these questions in the comments section. I don't know, Kristen, do you have anything that you were going to add in here? Or are we kind of just going to try and plow through some of the questions from here on out?
Yeah, I think it's a good idea to bring up who this pertains to. Like, does this start for people that were exposed on the 26th or later, or are they going retroactively? So we could start with that. Yep.
Okay. So basically we are, this guidance is dated December 26th. And since this guidance is dated on the 26th, it basically means that that's when it went into effect. One of the things that we're trying to do is, like I mentioned before, given some of the timing of how quickly we were able to get, how quickly we'll be able to get CommCare changes to be made. We're kind of in this little period where we're trying to work our way through this. Obviously, there are a lot of people who are open in the process of quarantine right now, and we're going to try and wind up going back and doing it sort of in a bulk way so that we can say, the 15,000 or so people that are in quarantine right now, we should hopefully be able to go in and fix those and have their quarantine dates changed and so forth so that you guys don't manually have to go in and do it. I think the main thing that we're asking for you guys right now, and obviously Amy and Kristen and Nora jump in if you want, I think the main thing that we're asking of you guys is that going forward, what we want you all to do is when you do that interview with a contact for the first time, we want you to change those dates so that we can make it be a 10-day quarantine instead of the kind of the default 14-day quarantine that's laid out for you. Everything else about quarantine is pretty much the same. They can leave their house, if you will, leave their their abode on the 14th. After day 10, so starting at day 11, but they should still be looking for symptoms on day 11, 12, 13, 14. I guess what we're asking for you is, as of right now, as of, December 29, when you're enrolling new contacts into the system, we want you to try and do this kind of prospectively and changing it to 10 days. And this will be until we can get CommCare to make those changes for us. You'll have to pay attention, like Amy says, you'll have to pay attention to, places, and for those of you who are still new at the script and are, kind of reading it, you are going to have to pay attention and, kind of mentally see where it says 14, you want to change that to 10. It's a very good idea to have a calendar nearby so that you can give people dates and so forth as well. If it turns out that we have difficulties with regard to changing all the people who are on quarantine from the 26th until today, retrospectively, if we may have to figure out a different way to do this and may have to go and do a lot of sort of manual changing. Hopefully that won't be the case. But we're starting to kind of work on that today. It'll slowly be done, with a handful to make sure that it works. And then the way that this works is we're going to have to sort of do it space by space. So it means county by county. So it may take a little bit of time before we can get everybody that change made, again, crossing our fingers, assuming that all goes well. So the hope is that over the next couple of days or so, everybody will be updated to this 10-day quarantine, and that you guys will continue to kind of do it forward until CommCare makes the changes that we're asking them to make. if somebody comes to you and during the course of, so if you're talking to people and today is their day 12 or their day 13, you can tell them that they are, free to leave their premises, but they still have to check themselves for symptoms until their 14 days is done.
Hey, Brian, this is Nora. On that point, we've got a lot of questions about folks who are maybe were exposed prior to the 26th, so they maybe are on day 5 now, but if they are on day 5 and the change went into effect on 12/26, they will have to quarantine for 10 days. It doesn't mean that is that correct?
Yes, right. So everybody has to quarantine for at least 10 days. So so whatever day they're on in their quarantine, as long as they were in quarantine on the 26th, or their quarantine started or should have started on the 26th or later, then they're sort of covered by this. Right. So it should be pretty much everybody who's active at this point, because if you were, off quarantine on December 25, obviously this doesn't pertain to you at all. It sounds like everybody who's open and active right now is going to have to get sort of adjusted, with regard to this, and we're going to try and wind up doing that backwards with some sort of bulk changes we can hopefully make. But everybody going forward, from when you do a new interview with a contact, even if their exposure to the contact was, on Christmas Eve, so before this was in place, their quarantine actually is in place now after the 26th. So it should be, it's 10 days from when they were last exposed to that person. Make sense? Hopefully.
Yeah, so it's not just about exposure date. There's a lot of questions about exposure date versus, so basically if they are actively in quarantine and you talk to them either today because it's an initial or you talk to them today because it's a monitoring call, you can go through the changes that Amy presented to change it to a 10-day quarantine and shorten it, and then click the resend so they get new papers accordingly. We will be distributing an FAQ with some sample language, and we'll be distributing, I think it's actually already up on CT support, like a quick reference guide on all the things that Amy presented, as well as how to change the quarantine date, as well as, how do you calculate it. So that'll be up on CT support. This webinar will be up on CT support as soon as possible. And then we will be doing like an FAQ with a lot of the questions you guys are posting in the chat, so that everybody has a consistent answer. And then again, Brian said it a couple times, we are working on the CommCare, official scripting change, as well as like a bulk upload to change people automatically rather than going through manually. There's a lot of questions on whether or not contact tracers should go through manually all of their contacts and start changing that. I don't think we recommend that right now. I think we want you to focus on initial interviews and making sure that those are completed and contacts are being reached and put into quarantine for 10 days. So know that change is coming. So don't kind of dive into that, click, 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 click administrative function. But going forward, anybody you talk to, that date should be changed to a 10-day quarantine.
The other thing that Nora mentioned there was about the paperwork for individuals, their quarantines, their end quarantine date and so forth, the button that y'all push to give them a quarantine notice. I don't know if any counties are on here, we're able to make it in, but we are working with counties to try and get those documents changed as well, so that the documentation that you guys email out through that push button to the individuals in quarantine will also now be changed to switch from 14 days to 10 as well. So that's that's something that we're working on in parallel here as well, getting all those 57 documents, one for each county, altered and changed and put in so that so that when you give somebody, when you push that button and it emails out a quarantine notice to individuals, that is now accurate as well.
So, Brian, this is Claudine. Can you hear me?
I can.
Okay, excellent. So we have the full hour reserved. So I don't know if the preference is to go through some of the questions or as many as we can that are posted in the chat, or if the preference is to collect all the questions and then provide a Q&A following the call and the webinar. Does anybody have any preferences on how to proceed? Nora, Amy, or Brian?
I'm okay if you just, I'm okay if you just want to, go through and pick some winners and ask them and go from there.
Yeah, I
would do it myself, but I see how far behind I am already.
I know, and I'm probably going to start at the most recent up. I did see one though that I wasn't sure was addressed that caught my eye, and so the question relates to if someone is already is still within the quarantine period and they're positive, they should stay within. Should they be stay in quarantine for full 14 days?
I'm sorry, say that again?
So if someone is in quarantine and then they are tested, they become positive for symptoms, should they stay in quarantine for the full 14 days versus the shortened quarantine period of 10?
Yeah, so somebody who has symptoms should be in quarantine for the full 14 days. I mean, the 10-day thing is only if the person is asymptomatic during the duration of, during that 10-day quarantine. If someone has, we've never kind of let people out of quarantine while they still had symptoms, right? It's because quarantine, right. The whole point of quarantine is to try and capture people and sort of make sure or hope that they don't have the virus before we let them go. If they have symptoms during the course of that could mean that they have shifted from being negative to positive. It's why we put them in that PUI hub. It's why we, hopefully don't let people out of quarantine while they still have symptoms, because we want to, keep them, quote unquote, under control, if you will, if they're still positive. If someone gets symptoms and they get symptoms on, day 4 or day 8 or day 10, or now even after day 10 on day 13 or 14, we want to make sure that they, relay those symptoms to the local health department or their provider and hopefully get a test to prove that they're not positive.
Okay. Thanks for that. And then let's see, I'm just going to start at the bottom again. Let's see.
While you're looking, I see a question here about travelers too. So travelers, you can't. So the only thing that has changed with regards to travel. So you can still do the test before you leave your where you're coming from. Test within a couple of days after you get back into New York State. That still is in place. If travelers have sort of always had a choice. They could either do that test out option, or they could go into quarantine for the full 14 days. Now travelers, if they choose to not get a test, will just be in quarantine for 10 days, not 14. And it's 10 days from when they were last in, a state that's not New York.
All right. I see one related to guidelines and PUI. So it reads, many of the counties have different guidelines for conversion to a person under investigation or PUI. Is it only these symptoms that affect the 10-day release, or is it any of the symptoms on our form? I don't know if that's something that's...
If they're, if they're a PUI, if they've been converted to a PUI, the county should determine whether or not that person, in theory, if anybody is symptomatic and they're symptomatic enough for you to put them into a PUI, they shouldn't be getting off of quarantine at 10 days. They should be stretched until 14.
Okay, let's see what else they have. Amy, if you see any questions that you think need to be addressed, jump in. I'm just scrolling. There's so many of them. There's like over 300 questions, so trying not to address questions that
the SMS ones, I've seen a couple on that. SMS is something, the text message part is something that we're going to have to wind up fixing as well. Hopefully that will be, something that we'll be able to fix as well. For now, again, their texts you may have to tell them your text message may say 14 days, but it is 10 as long as you remain asymptomatic, that type of thing.
So Brian, do we know, so if someone's released from quarantine and they get symptoms on day 11, 12, 13, or 14, or day 12, 13, or 14, the question, and let's say the SMS text messaging issue has been resolved, how will they be reporting symptoms that develop on the 12th, 13th, or 14th day if they were asymptomatic on day 10?
Yeah, so I think this is going to be let's say this. I think this is going to be something that is going to be the kind of on the honor system, if you will. I think as we're going to do this, I think the SMSs, the text messaging systems, the end of quarantine, if you will stop at the end of day 10. The recommendation is that they should self-monitor for symptoms for the remaining 4 days. And if they have symptoms, they should wind up checking, contacting their local health department or contacting their provider.
Okay, thank you. I'm just looking up here. And as you address that, has the quarantine notice been updated to reflect the 10-day change? Do we know the answer to that?
So that's something that I tried to mention that earlier. That's something that each county has its own different quarantine notice. So there are 57 different quarantine notices that have been kind of plugged into ComCare, if you will. We're working with county health departments to get those changed as well. Over the next day or so, we hope that they'll all get changed. So whenever you as a contact tracer pushes the button to send that to a new contact, for example, that you've just interviewed, the hope is that will have shifted from 14 days to 10 as well. But it may take a couple of days for us to get them all from counties and then uploaded into ComCare.
Okay, and Nora addressed the issue about efforts to do bulk correction to quarantine dates in ComCare so that people are spending time making initial contact and interview efforts versus the administrative function of updating content in ComCare. So that was addressed. And let's see what else I can see.
So here's a question, Claudine, Brian. This is fun. This is like interviewing Brian. Brian, what do you say about? Charles says that if a quarantine contact is at 10 days and becomes symptomatic, should we change the quarantine end date to 14 days and resend? But if a person becomes symptomatic, it would become a PUI and go through the PUI workflow. Right, Brian?
Correct.
So we're not changing end dates from 10 days to 14 days. Contact tracers are taking contacts who are not symptomatic and making their 14 days 10 and close, ending their quarantine. If they are symptomatic, they go through the PUI workflow for your county and get flagged as a PUI and are processed as a PUI, and then hopefully get tested and then come back around.
That's the way it's supposed to work.
So I have a question, Brian, here that reads, if a person is showing symptoms within the first 10-day period, then they happen to test negative by day 9 or 10, do they still stay in quarantine for 14 days because they were symptomatic previously, but now they have a negative test?
That's an interesting one. So we have always said that you can't test out of quarantine. I'm trying to think about how this would impact the dates for, the 10 versus 14 thing. I know there are some counties that take PUIs, and sort of kind of pass them back to VCC. Can I beg off that one and try and figure out what the right answer for that is with regards to the kind of the math of that?
Yep. That's why I read it, because it was an interesting one. But
yeah, Amy and I we may have to talk about that one.
Okay. All right. Let's see. One contact. I'm reading. Hang on.
Oh, I'll jump in, Claudine.
Oh, absolutely, Nora. Mine keeps jumping all over the place. So
okay, good. Ahead. Yeah, mine too. So if contact tracers update a contact who was in quarantine before the 26th and now maybe it gets shortened because they're in day 11, will that mess up the bulk update that we're planning to do? I don't think so, because I think we're going to be pulling people who are active, and that person would no longer be active. But I would defer to, we want people to have the right information about the end of their quarantine date. So even if it messes, don't worry about messing up the bulk information. I would prefer that the contact have the correct information about the end of their quarantine date, because if they don't and they get a text that says, you're on day 13, and there's an announcement that goes out and they hear from their paper that it's day 10, then we're going to get a call from them anyway. So I would say we should make sure that their record is correct for the 10 days of quarantine. It should not impact the bulk upload, and if it does, we will address accordingly.
Okay. Yeah, that's good. I found one. They jumped this, so let's see if I can find another one that we haven't addressed.
There's a lot of questions as we're going through these. There's still a lot of questions in there about dates. So basically, anybody who is open right now, anybody who you are planning on interviewing now, or is in your list of active and open contacts, this applies to, right? So even if their exposure, even if you're just getting around to, if the county just interviewed them because they were, unavailable around Christmas or whatnot. I mean, if they're, if your first interview with them is today and it actually is just, day 9 from when they were exposed to someone, this still applies to them. And if you get someone who has been in your, your workspace and has been, somebody who you've been interacting with, and today is day 13 for them, this still applies to them as well.
Oh, let's see. I saw one. Hang on. I just saw a good one about, hang on. All right. So how do we set the end quarantine date for young children who cannot be separated from their mothers? Is the end quarantine date equal to the end of the mother's isolation days plus the mother's isolation plus? Go ahead.
So that stuff hasn't changed at all.
Okay.
It is, your quarantine date now, it was 14 days from the last day that you were exposed to a positive case. Now it is 10 days. So none of that has changed at all. So if you are still, if that child and that, that mother or child, depending on whoever the positive is, I assume that the two of them are in close contact with one another. And the 10 days would start after the last day of isolation for whoever the positive is. Okay. I know. So, but one of the reasons why we did not have you guys making changes to end quarantine dates is because a lot of that is based on the county health department, right? The county health department does the interview with the positive case, and at least until recently. And those positive cases are, they're the ones who tell us that they've had, what the type of contact they've had with particular individuals. We key that off the case, not necessarily off the contact. And I know there have been times in the past where there have been where, sometimes the case says, no, I haven't had contact with someone since then, but the contact, says, oh yeah, I had dinner with this person last night or whatnot. We still defer to the county health department when it comes to saying, when the last time that they had contact with someone was. So, doing this for these, that's the way it's supposed to be. But, we're going on the kind of the interview of the kind of the case in terms of telling us that, if that makes sense.
So I have a question here, Brian, that reads, so if someone tests positive in the middle of or in the course of the quarantine period, they're asking if the clock is reset on the day that they're determined to be positive and then the quarantine's extended.
If they test positive, they're no longer in quarantine, they're in isolation.
They'll become a point. Yes, they're in isolation. Okay. Yep, that's a good point. And then, let's see. A lot of similar questions, so I don't want to repeat too many of them.
So one of the questions that I keep seeing is if someone is only converted to a PUI when they are positive. No. Someone can be converted to a PUI when they are symptomatic. Correct.
PUI basically means they've got symptoms and there's a possibility that they could have COVID. So, that's when we usually try and punt them over, and we have the county health department kind of evaluate whether or not, based on the symptoms, they think that could be COVID. They oftentimes give a recommendation or try and help out with regards to getting a test for that particular person. But a PUI doesn't always necessarily mean, that they're a positive case. It means they need further evaluation. And many of you guys we try and leave the kind of the clinical evaluation of somebody to the county health department, not to you guys in VCC.
I think, Brian, some counties are only having the VCC contact tracers use the PUI hub for people who test positive because they are maybe not tracking those who develop symptoms. Best practice is that if someone develops symptoms, they are triggering the PUI hub and the PUI process so that we can investigate it further whether or not they have symptoms of COVID. We understand there might be nuances in the regions for different contact tracers.
Mm-hmm.
I see a couple of comments that might be helpful for Amy to weigh in on because it relates to closure of the file. So Amy, I know that in prior trainings, there's been messaging that's been pretty specific about not closing files. So I wanted to point out that there are a couple of questions that are asking, should we close the file if we are currently monitoring the contact through follow-ups on day 11 through 14? Or should we close the file and the record if there's nothing happening after days 11 and 14? So did you want to comment on that about just clarifying expectations for closing the files and record?
So a contact record should be closed after the quarantine has been completed. So whether that's the 10 days, it's been extended because they're a household member, or they're missed the cutoff and they're completing 14 days, it just gets closed once the quarantine has been completed.
All right, thanks. You addressed the script clarifications. So let's see. Technology. I saw something about essential workers. Hang on a second. Oh, that's...
Yeah, we can talk about that if you want. I mean, essential workers are we have two different issues here. Healthcare workers, there's going to be a new kind of flow with regards to healthcare workers, and that should be being relayed to the, when they report that they're ill or that they're in quarantine to their, boss, supervisor, employer. Those folks should know kind of how to handle that. That's going to get relayed to them if it hasn't been already. Basically, there's a way to report for healthcare workers that, we have people in quarantine and, but we need them to come in. For other essential workers, this shouldn't change anything. Healthcare workers, essential non-healthcare workers should be allowed to, quarantine while not at work, and then quarantine while they're not at work the same way they had before. It's just the quarantine is shorter from 14 days to 10.
All right, thanks. And so that was one of the questions towards the end of the Q&A. There were well over 300 Q&A questions. Some of them were related to technology issues in the beginning, but as we typically do, we'll capture the Q&A questions from the chat, and we can use those to develop some frequently asked questions and provide additional clarifications. And we are approaching 1 o'clock. It's 12:59. So, Nora, I don't know if you have any closing remarks, but I just wanted to thank everybody for coming together so quickly and shifting the focus. And, I know there was a lot of people that were trying to get in. And again, this session has been recorded. The recording will be posted on the CT support site following the training event today. Nora, did you have anything else that you wanted to add?
I just want to thank you, Claudine, thank Brian, Amy, Kristen, everybody for pulling this together. Also, I know we say it a lot, but thank you to all of the contact tracers for really being nimble and asking great questions about this. Is a pretty big change, and we know that, so bear with us. It's going to be messy for a little bit, but we're going to get information out as soon as possible, and thank you, as always, for all your attention, and we will be talking soon.
Okay, great. Thank you, Nora. And I want to assure the contact tracers that we did not lose today's training presentation on the food insecurity. Our presenter has graciously agreed to present on Tuesday, January 5th, so we will be issuing an updated meeting invitation to that training event. So thank you, everyone, for participating today, and this concludes today's training event. Thank you.